Have you ever experienced a sudden, intense pain in your upper abdomen or the right side of your body after a heavy, fatty meal? Or did you notice a discomfort that radiates to your back or shoulder? These could be warning signs of a common yet often overlooked health concern: gallstones. In this video, we'll explore the 6 most common signs and symptoms of gallstones that will give you the knowledge to recognize them and seek appropriate medical attention. But before diving into that, let's first understand gallstones and their primary types. Gallstones are small solid particles in the gallbladder, a small organ located just beneath the liver. These stones can vary, ranging from as small as a grain of sand to as large as a golf ball. Gallstones are primarily composed of substances found in bile, a digestive fluid produced by the liver and stored in the gallbladder. The 2 primary types of gallstones are cholesterol gallstones and pigment gallstones. Cholesterol gallstones. Cholesterol gallstones are the most common type of gallstones, primarily composed of cholesterol. Cholesterol is a fatty substance ordinarily present in bile. When the balance of cholesterol, bile salts, and other substances in the bile is disrupted, it can lead to the formation of these stones. Cholesterol gallstones can vary in size and may appear yellow or green. Pigment gallstones. These are primarily made up of bilirubin, a pigment resulting from the breakdown of red blood cells in the body. They tend to be smaller and darker in color, often appearing brown or black. Pigment gallstones can form when there is an excess of bilirubin in the bile, which can be caused by conditions such as cirrhosis, blood disorders, or infections. Fear not, we're here to help you recognize the signs and symptoms early on. So if you've ever wondered what those warning signals are, you're in the right place. Let's start with number 1, abdominal pain. Abdominal pain is one of the most prominent and distressing symptoms associated with gallstones. This pain, often referred to as biliary colic, typically occurs in the upper right or center of the abdomen, but it can also radiate to the back or the right shoulder blade. The sensation of this pain is often described as intense and can be sudden and recurring. Gallstones are the primary culprits behind this abdominal discomfort. These small solid particles can block the gallbladder's neck or the bile ducts, obstructing the normal flow of bile. When this happens, the gallbladder contracts, attempting to expel the trapped bile and gallstones, resulting in sharp and cramp-like pain. The duration and severity of the pain can vary. Some individuals may experience short, intermittent episodes, while others endure prolonged, excruciating discomfort. Dietary choices such as consuming too much fatty or greasy foods can trigger these painful attacks. Recognizing this abdominal pain and seeking prompt medical attention is crucial to address gallstone-related issues and prevent further complications. If you or someone you know is experiencing such symptoms, consult a healthcare professional for a proper diagnosis and guidance on managing gallstones. Number 2, nausea and vomiting. Nausea and vomiting are common symptoms associated with gallstones and gallbladder issues. When gallstones obstruct the normal flow of bile, it can lead to irritation and inflammation of the gallbladder. This irritation triggers signals to the brain, resulting in feelings of nausea. The presence of gallstones can exacerbate this sensation, causing discomfort and prompting the body to expel the irritants, leading to vomiting in some cases. The nausea is often experienced alongside other symptoms, mainly when gallstones cause intermittent or continuous obstruction in the bile ducts or the gallbladder. The severity of nausea can vary from mild discomfort to persistent queasiness. Vomiting might occur as the body attempts to eliminate the distressing elements that trigger the pain. However, it's important to note that not everyone with gallstones experiences these symptoms, and the severity and frequency of nausea and vomiting can differ from person to person. Number 3, jaundice. Jaundice is a condition characterized by the yellowing of the skin and the whites of the eyes, and it can be a concerning symptom of gallstones. Jaundice in the context of gallstones typically occurs when gallstones obstruct the common bile duct, a crucial pathway for transporting bile from the liver and gallbladder to the small intestine. Normally, bilirubin, a yellow pigment produced when red blood cells break down, is excreted from the body through bile. However, when gallstones impede bile flow, bilirubin accumulates in the bloodstream, causing the characteristic yellow discoloration of the skin and eyes. The presence of jaundice and gallstone-related issues is an indication of a significant problem. It's often accompanied by other symptoms like abdominal pain, nausea, and vomiting, and may even lead to fever and chills if an infection develops. Jaundice warrants prompt medical attention as it may signify a blockage that needs to be addressed to restore the normal flow of bile and prevent further complications. Physicians will conduct diagnostic tests to identify the underlying cause of jaundice and determine the appropriate treatment, which may include the removal of gallstones or the surgical removal of the gallbladder. Number 4. Fever and chills. Fever and chills can be alarming symptoms associated with gallstones, signaling a more serious complication that demands immediate medical attention. Gallstones can lead to these feverish episodes when they obstruct bile flow through the bile ducts, creating a conducive environment for bacterial growth. When gallstones prevent the normal flow of bile, this stagnant fluid can become a breeding ground for bacteria, potentially leading to an infection within the gallbladder or the bile ducts. This infection is often characterized by an increase in body temperature, resulting in fever and accompanied by chills or shivering. Fever is the body's natural response to infection, raising the temperature to help combat the invading bacteria. This immune response can make you feel warm and flushed. On the other hand, chills are a reaction to the fever as the body attempts to regulate its temperature. They often manifest as shivering and a feeling of being cold. These symptoms should not be taken lightly, as gallstone-related infections can lead to more severe complications if left untreated. If you experience fever and chills with other gallstone-related symptoms, seek prompt medical evaluation to diagnose and address the issue effectively. Number 5. Changes in stool and urine color. Gallstones can lead to noticeable changes in stool and urine color. When gallstones obstruct the normal flow of bile, it can directly impact the appearance of these bodily waste products. The stool may become pale or clay-colored, losing its characteristic brown hue. This change occurs because the bilirubin in the bile, which gives stool its standard color, is not reaching the intestine. Conversely, urine may darken due to the accumulation of bilirubin in the bloodstream, which is then excreted by the kidneys. These stool and urine color alterations are telltale signs of gallstone-related issues and often prompt individuals to seek medical attention for a proper diagnosis and treatment. Number 6. Indigestion and bloating. Indigestion and bloating are common symptoms associated with gallstones. When the gallbladder is not functioning optimally due to the presence of gallstones, it may not release bile efficiently to aid in the digestion of dietary fats. As a result, individuals with gallstones often experience difficulty digesting fatty foods, leading to discomfort, indigestion, and a sensation of fullness. Bloating and flatulence may also accompany these symptoms. The inefficient digestion of fats can cause various digestive issues, making meals, especially those high in fat, an unpleasant experience. Remember, this video is for educational purposes. We are not giving you medical advice. You should always consult your doctor if you need any professional opinion. Did you find this video helpful? If yes, then make sure to like this video, subscribe to our channel, and hit the bell icon to view more upcoming Create Cure content like this.